It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelley with more IRG Health Talk.
Our next guest is Dr. Ahmet Tural, an infectious disease doctor for Providence Regional Medical Center. So he is intimately involved with this coronavirus situation that was at Providence Medical Center. And these two doctors that we're talking to today, Dr. Campbell and Dr. Tural, very much at the forefront of the treatment of this.
Oh, yeah. Dr. Tural was in the forefront treating the patient.
All right, we're going to talk to him with Shannon O'Kelley right now on Como.
Dr. Tural, how are you?
I'm well, Shannon. How are you?
Doing great. Hey, thanks for joining us here on Health Talk. You're an infectious disease medicine provider, physician. Tell our listeners kind of the day in the life in your practice and your area of interest and what you do day to day. Fascinating stuff. I think you're the first infectious medicine doc we've had on Health Talk, so congratulations for being first.
Thank you. Yes, I'm an infectious diseases physician in clinical practice, which basically means that I take care of patients as opposed to other infectious disease physicians, maybe primarily focused on research and so on. I work up in Everett in Providence General, Providence Regional Medical Center now. We take care of patients all day, and coronavirus or other, whatever comes our way, we have to be prepared to deal with them.
Well, the coronavirus obviously is very media relevant right now with what's going on in the world and coronavirus. As an infectious medical provider, your job is to really identify the disease, to identify the bug or whatever's causing the problem, then kind of figure out how to treat it, how to contain it. So tell us about how you learned to do that. Are you essentially an internal medicine doc that went on to specialize in infectious diseases?
Exactly. Infectious diseases is a subspecialty, as we call it, of internal medicine, at least in this country. That's how it works. Yes, we do have protocols and safeguards in place to allow us, to help us identify potential threats to others in public health specifically. In doing that, we look for clues in patients presenting symptoms and their history, such as fever, cough, as is relevant here, or spitting up blood, coughing up blood, and then some of those may be enough to trigger a protocol, and we initiate isolation protocols and testing and so on. In this context, travel history, knowledge of current epidemics, these are, of course, very relevant. And in this particular patient, that the first case of novel coronavirus infection in the United States, he happened to present to our hospital. So in this case, travel history was very relevant. He became ill really within a day or two after arriving in the United States, after a visit to Wuhan city in China, which is the center of this epidemic. Then he knew he was a very well-informed individual, and he was concerned about this possibility. So when he presented to a local clinic, walk-in clinic, he relayed this concern to the providers, which was extremely helpful. So he was put on a mask and placed in a private room immediately, and the local health department officials and the CDC were contacted, and then he was managed appropriately. And during that visit, he had respiratory specimens and other serum specimens were obtained for testing, and those were sent to CDC and tested for the novel coronavirus, and it came back positive. So the results, the infection was confirmed within 24 hours.
Yeah, Providence was on the national news. I remember getting up and watching Good Morning America or something like that, and there they were, Everett, Washington, with this first case. And then, so how are you guys informed as medical providers looking out for these diseases? I mean, whether it's a virus or a bug, maybe you could tell our listeners, I mean, how does it start in kind of the eastern part of the world? Why does everything come out of China and kind of come our way?
Yeah, we really don't know why these epidemics come out of China, but one idea appears to be that the local consumption of exotic animals for food seems to be relevant. And in this case, all the initial cases were traced back to a livestock seafood market in Wuhan city.
More with Dr. Ahmet Tural coming up after this on Como.
It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelley.
We continue our conversation with Dr. Ahmet Tural and Shannon O'Kelley on Como.
Dr. Tural, thank you again for joining us. So just to kind of review, is it safe to say that these viruses that we're, particularly coronavirus right now, is a virus that comes from an animal that has spread to humans? The human body is not used to that, and we have no immune system to it, so that's why it spreads and it's hard to contain, and it causes this kind of fear or concern?
That's correct. The coronaviruses are very common, and they're also known to involve birds and animals. There's really widespread involvement. And at some point, given the opportunity, these viruses can make the jump from the birds and the host animals to humans. And these livestock markets in China may provide that opportunity.
Yeah, and so since we don't have the immunity as humans to it, because this is the first time we're seeing it, the concern is that it's going to spread human-to-human contact. I mean, we should probably talk about prevention, care, concerns with travel. Do these masks work? I mean, what should we worry about? I guess I'm asking.
In terms of risk to travelers, again, it depends on the virus's ability to transmit from person to person. In the case of novel coronavirus, we didn't know early on whether the virus was transmitted at all, person to person, because all of the initial cases were tied to that market and direct exposure to animals and the market. But later, this has been confirmed, and we do now know that there is reasonably efficient person-to-person transmission. In fact, this virus is probably overall relatively similar to the SARS virus, but SARS virus caused about 8,000 cases worldwide over about 9 months, and we are already up to more than 20,000 cases with this virus, and it's been going on for a little over a month.
Right.
So it's clearly it's a more efficient transmitter.
Transmission-wise, is that droplets? Is that airborne? Is it saliva? Do they know the transmission kind of vehicle?
That is still being defined, but the main mechanism of transmission seems to be droplet. So similar to influenza. Mm-hmm. So these, whenever we speak, we put out these droplets, and they travel about 3 to 6 feet before they settle. And if we're in someone's orbit that close, we are at risk. So in that context, wearing a mask offers some protection, but it is not proven to be highly effective, and it is really not recommended as a standard measure in this case, so as to avoid false sense of security. Good hand hygiene, good respiratory hygiene are essential.
And signs and symptoms, if you do or feel like you have the flu, what are the differences between the normal influenza and this new coronavirus?
In this case, it's typically the prodrome is 3 to 6 days, followed by a dry cough and fevers and some body aches, in some cases gastrointestinal symptoms, and escalates from there with the involvement of lower respiratory system and pneumonia.
Wow, so much information and so little time to cover it all, but you did a great job in the time that we had. Thank you so much for the information, and good luck out there.
Thank you, Shannon, for having me.
You've been hearing Dr. Ahmet Tural, infectious disease doctor for Providence Regional Medical Center, talking about the Wuhan coronavirus, and people are taking a lot of precautions about this. Boy, if you have any sort of symptoms, they really want you to get in touch with the doctor and make sure you're not coughing and doing things like that around folks. So, again, thanks to Doctors Campbell and Ahmet Tural for joining us. We're back with our final segment after this time out on Como.